Good afternoon, Ryan. So welcome back to the exercise program. So today we are going to proceed on to the exercise description. So before I proceed, how are you feeling today?
I'm feeling good.
Okay, however, at any point of time I feel unwell, please inform me immediately and I'll stop the exercise to prevent any injuries or complications.
Sure.
Okay, so before we begin, so based on the assessment, it seems that you might have some postural deviation with some kyphosis. Do you know what is kyphosis?
No, what's kyphosis?
Kyphosis is a over rounding of our back, which may indicate that you might have poor posture and is an indication that you have weak core muscles.
Okay.
Right. So before you begin the exercises, let me brief you through the warm up to do. Okay. So for the first warm up, I will require you to put both your hands forward.
Okay.
Follow me along while I perform the exercise.
Okay.
And then slowly twist to your right side.
Okay.
Then to the left. I only perform this for 3 reps.
Sure.
Ready?
Yes.
1, 2, and 3. Alright, for the next one, I will require you to do the quadricep pendulum swing. So I'll need you to place both of your hands onto the wall.
Okay.
And then swing your left leg to the side. So I need you to perform 3 reps.
Okay.
1, 2, and 3. Now we alternate. Same thing for next side. And 3. Alright. Okay, so Ryan, how are you feeling?
I'm feeling like my body's warmed up.
Okay, so the purpose of warm up is actually to increase your blood flow, increase your range of motion, and also psychologically prepare you for the next exercise to minimize the risk of injuries.
Okay, sounds good.
Okay, so now we move on to the exercise. So the first exercise we are going to perform the push-ups. The push-ups actually help to target your pectoralis major, triceps, and your deltoids, and also engages the core as it stabilizes the body while doing the movement.
Okay, sure.
Okay, so allow me to demonstrate and explain to you how is it performed.
Okay.
So to perform this exercise, I need to place both of your arms shoulder width apart onto the floor.
Okay.
And both of your legs straight behind.
Okay.
So this is the starting position. So once you are ready, I'll need to lower down your body towards the surface of the floor. This is the downward face. During this downward face, I will need you to inhale and then you push up. So when the pushing up face is actually called the upper face, and I will require you to exhale because you are contracting your pectoralis muscles. Okay, so some of the safety cues. I'll be standing next to you to in case you might fall over to minimize injuries, and also throughout the whole exercise, please maintain a neutral spine and perform the exercise in the pain-free range of motion. So some of the common errors. Some people might lock their elbows as they are going up the upper face, which may lead to elbow injuries. Furthermore, some people might hyperextend their back, which can lead to back injuries.
Okay.
Alright, so once you're ready, I will need you to perform 3 reps for me.
Okay, sure.
Alright, Ryan, based on my observation, for the first 2 reps you are performing everything correctly. However, for the last rep, I noticed there's some slight hyperextension of the back. So try to maintain a neutral spine because it can minimize the risk of back injuries.
Sure.
And make you perform the exercise more comfortably.
Okay, sure.
Alright. Next we move on to the next exercise, which is called the squats.
Okay.
So have you done squats before?
No.
Okay, so the purpose of squat is actually help to strengthen your quadricep muscles as well as your gluteus maximus. So allow me to demonstrate to you and explain how it's done.
Okay.
Okay, so I will need you to place both of your feet shoulder width apart, and then place both of your arms behind your head. So this is the starting position. Once you are ready, I will require you to bend your knees and slowly lower down your body. So this is actually called the downward face. During this phase, I will need you to inhale, and once you are ready, you push up, and this is called the upper face. During upper face, I will require you to breathe out as you are contracting the quadricep muscles.
Okay.
Some of the safety cues, similarly, I will be standing behind you in case you fall over to prevent any injuries. And also, when you are performing the exercise, try to maintain a neutral spine and perform the exercise in the pain-free range of motion.
Sure.
Okay, so some of the common errors, try not to keep your your feet too narrow or too wide, as too narrow can actually lead to instability and cause you to fall.
Okay.
Alright, so once you're ready, I'll require you to perform 3 reps for me. Alright, Ryan. So based on my observation, everything was done perfectly. However, I noticed that your knees are a bit flared out to the sides. So make sure make sure that your knees are parallel to your feet. As if the knee is too flared out, it can actually lead to knee irritation and cause knee injuries. Okay, so now we'll move on to the next exercise, called the pull-up Superman.
Okay.
So this actually helps to target your latissimus dorsi, as well as your rhomboid and all the upper back muscles.
Sure.
Okay, so allow me to demonstrate and explain. So I'll leave you to lie down supine onto the floor. And place both arms forward. And once you are ready, I'll need you to pull your arms backwards. So this is called the pulling phase. During this pulling phase, I'll require you to exhale as you're contracting your latissimus dorsi muscles.
Sure.
Once you're ready, I'll require you to stretch your arm forward. This is called the pushing phase. And I'll need you to inhale.
Okay. Sure.
So some of the safety cues, I'll be standing next to you in case your upper body might start to fall to the front.
Okay.
And some of the common errors to avoid, try not to leave your hyperextend your head, as you can lead to neck injuries. Furthermore, try not to maintain a neutral spine and perform the exercise in a pain-free range of motion, so that you do not cause any back injuries. So once you're ready, you can start performing 3 reps.
Okay. Sure.
Alright, based on my observation, your neck tend to look up a little bit. So this can actually lead to neck strain and may cause neck injuries. So in the future, try to look down to the floor slightly more, as it can lessen the strain in the neck.
Okay. Sure.
Okay, so once you're now I'll move on to the FITT principles. So I'll require you to perform this exercise for 3 times a week, and during each session, I require you to perform 4 sets of 6 reps. So during after each set, I require you to rest 50 seconds before proceeding to the next.
Sure.
Alright, so now before we end off, I'll require you to perform some cool downs with me, so that we can cool down your body temperature and make you feel more relaxed and prevent any muscle cramps in the future.
Sure. Okay.
Alright, so for the first exercise, I require you to hold on to the wall, okay, and stretch your left quadricep muscles. Okay. Hold this position for 5 seconds.
Sure.
1, 2, 3, 4, 5. Relax. Now we'll change the next side. 1, 2, 3, 4, 5. Okay, so now we are gonna perform the hamstring stretch. I will require you to stretch your leg forward. Okay. And then you reach your fingers onto your toes. Hold this position for 5 seconds. 1, 2, 3, 4, 5. Change. 1, 2, 3, 4, and 5. Okay, so for last cool down, I will need you to stretch your arms forward, and then place the non-stretching arm over your stretching. The tricep you're gonna stretch. Hold this for 5 seconds. 1, 2, 3, 4, 5. Next. 1, 2, 3, 4, 5. Alright, Ryan, thank you for your active participation. I hope to see you soon, and we will find out if the exercise program is effective for you. Hope to see you again soon.
Okay. Thank you, Brandon.
Thank you.